Hey everyone, and welcome back to the channel. Today, we're re-diving into a really important health topic that often goes unnoticed until it's more serious. Fatty liver disease. You might have heard of it, but do you know the early warning signs? Your liver is a powerhouse organ, performing over 500 vital functions. But when excess fat builds up, it can lead to inflammation and damage. The tricky part is that in its early stages, non-alcoholic fatty liver disease, or NAFLD, often has no symptoms at all. This, what's sometimes called a silent disease. Millions of people are walking around with it and have no idea. But as the condition progresses, your body might start sending you some subtle signals. Paying attention to these early clues can make all the difference in catching it early and reversing the damage. So, let's talk about what you should be looking out for. One of the most common, yet easily dismissed, signs is persistent fatigue. We all get tired, right? Life is busy. But this isn't your typical I need more coffee kind of tired. It's a profound, lingering exhaustion that doesn't seem to get better, even with a good night's sleep. It's the kind of fatigue that can interfere with your daily life, making it hard to concentrate or get through your workday. This happens because a struggling liver can't efficiently process nutrients and toxins, which can drain your energy levels. If you're feeling unusually drained for weeks on end without a clear reason, it might be more than just stress or lack of sleep. It could be your liver trying to tell you something's wrong. Don't just brush it off. It's a significant clue that warrants a closer look. Another sign to be aware of is discomfort or a dull ache in the upper right side of your abdomen. This is where your liver is located, right under your ribcage. The feeling might not be a sharp, intense pain. Instead, it could be a vague feeling of fullness, pressure, or a persistent dull ache. This discomfort can be caused by the liver enlarging due to fat accumulation and inflammation, which then stretches the sensitive membrane surrounding it. You might notice it more after eating a large or particularly fatty meal. Because it's often not severe, many people ignore it, thinking it's just indigestion or a pulled muscle. But if you're experiencing this type of localized discomfort consistently, it's a good idea to mention it to your doctor. It's a physical signal that directly points to the area of concern. Now, let's talk about something a bit unexpected: skin issues. Your skin can be a mirror reflecting your internal health, and your liver is no exception. While more severe liver problems are known to cause jaundice, which is the yellowing of the skin and eyes, earlier stages can present with more subtle signs. You might notice unexplained itchy skin, known as pruritus, without any visible rash. This itching can be widespread and quite bothersome. Another potential sign is the appearance of spider angiomas. These are small, spider-like blood vessels that appear on the skin, typically on the face, neck, and upper chest. They happen when estrogen levels rise, because a compromised liver can't metabolize hormones properly. A few small ones might be normal, but if you suddenly notice several new ones appearing, related to your liver's health. Have you ever felt nauseous or lost your appetite for no apparent reason? These can also be early indicators of fatty liver disease. A feeling of nausea, especially in the mornings, or a general loss of interest in food can stem from your liver's reduced ability to function. When your liver is inflamed, it can affect your entire digestive system. You might feel full quickly after eating only a small amount of food. This, combined with a loss of appetite, can sometimes lead to unintentional weight loss. While losing weight is often seen as a good thing, unexplained weight loss when you're not actively trying is a red flag your body is sending. It's a signal that something is off internally, and your liver's health should be considered as a possible cause. Don't ignore these digestive disturbances. They are important pieces of the puzzle. Another subtle sign is brain fog or difficulty concentrating. You might find yourself being more forgetful, poking, having trouble focusing on tasks, or just feeling mentally sluggish. This is often referred to as hepatic encephalopathy in its severe stages, but even mild liver dysfunction can impact your cognitive function. Why does this happen? A healthy liver filters toxins, like ammonia, from your blood. But when the liver is fatty and inflamed, it can't do this job as effectively. These toxins can then travel to your brain, interfering with its normal function and leading to that foggy, unfocused feeling. You struggling to think clearly, and it's becoming a pattern. It's not just in your head. It could be a sign that your liver needs some attention and support. So, what can you do if you're re-experiencing some of these signs or are concerned about your liver health? The first and most important step is to talk to your doctor. They can perform simple blood tests, called a liver function panel, to check for elevated liver enzymes, which can be a sign of inflammation. They might also recommend an ultrasound or another type of imaging scan to get a direct look at your liver and see if there is excess fat. The good news is that in its early stages, non-alcoholic fatty liver disease is often reversible. The key is lifestyle changes. This isn't about a quick fix. It's about adopting healthier habits for the long term. One of the most effective strategies is gradual weight loss if you are overweight. Losing even a small percentage of your body weight can significantly reduce the fat and inflammation in your liver. This is best achieved through a combination of a balanced diet and regular physical activity. Aim for a diet rich in fruits, vegetables, whole grains, and lean proteins. Think of the Mediterranean diet. It's often recommended for liver health. It's also crucial to cut back on processed foods, sugary drinks, and unhealthy fats. These are major contributors to fat buildup in the liver. You don't have to be perfect overnight. Small, consistent changes add up to big results for your liver. Regular exercise is another cornerstone of managing and reversing fatty liver disease. You don't have to become a marathon runner. Aim for at least 30 minutes of moderate intensity exercise, like brisk walking, swimming, or cycling, most days of the week. Exercise helps you lose weight, improves your body's sensitivity to insulin, and can directly reduce the amount of fat in your liver, even without weight loss. It's about getting your body moving and making it a regular part of your routine. Find an activity you enjoy, because that's the one you'll stick with. Remember, every step you take is a step toward a healthier liver. Finally, it's really important to manage other health conditions that are often linked with fatty liver disease, such as type 2 diabetes and high cholesterol. Keeping your blood sugar and cholesterol levels in a healthy range is crucial for your liver. Work closely with your healthcare provider to manage these conditions effectively. Also, be mindful of alcohol consumption. Even if your fatty liver isn't caused by alcohol, drinking can put additional stress on your liver and worsen the condition. Cutting back or avoiding alcohol altogether can give your liver a much-needed break to heal. Remember, your liver is incredibly resilient, and with the right care and lifestyle changes, you can protect this vital organ for years to come. It all starts with recognizing the signs and taking action. Thank you so much for watching today. I hope this information helps you become more aware of the subtle signs of fatty liver disease. If you found this video helpful, please give it a thumbs up and share it with someone you care about. And forget to subscribe and hit that notification bell so you won't miss our future health videos. Stay healthy and see you in the next one.